All right, good evening, everyone. On behalf of Say Yes Guilford, I just want to welcome you and thank you so much for joining us for our virtual workshop, Mental Health Matters. My name is Alexis Moore and I serve as the Navigator and Project Associate for Say Yes Guilford. July is Minority Mental Health Month and we are very fortunate to have an expert here with us today, licensed mental health counselor Whitley Grant, who will serve as our presenter. And before she gets started, just to give some Zoom etiquette, we ask that you stay muted throughout the presentation and feel free to use the chat feature if you have any questions or anything you'd like to add, but there will be a Q&A at the end. And without further ado, I'll pass it to Whitley to get started. Thank you for joining us.
Been using Zoom for 1.5 years now, still forgetting to take myself off mute, but thank you so much for the introduction. I'm so glad to be in this virtual space with you all this evening. So whether you're listening live or listening to this recording, I'm definitely excited to talk about this topic with you all. And for those of you all who are going to listen to the recording, I completely understand as college students wanting to get that full break before the school year gets started. So I can definitely understand as incoming college students, maybe you didn't want to sit in this virtual space this evening, but hope that you get a lot out of the recording as well. So like Alexis shared, July is Minority Mental Health Month. And the title of this presentation is My Mental Health Matters, Centering Wellness as a College Student. So again, my name is Whitley Grant. I'm a licensed clinical mental health counselor, licensed clinical addiction specialist, and certified clinical supervisor intern here in the great state of North Carolina. So I first want to give a few more points about myself. So I am a student affairs practitioner and I've been doing the higher education profession for about 4 years now. So, but I've been a mental health counselor and a substance use counselor for about 5.5 years now. I am a second-year doctoral student in higher education at the University of North Carolina, Greensboro, and earned both my bachelor's and master's degree at North Carolina Central University. So for those of you out there listening, I hope that some of you all will be attending North Carolina Central in the fall or even a historically Black college. Because although North Carolina and there are great colleges all over the country, I definitely have a special place in my heart for those who attend historically Black colleges. Some of my expertise includes, of course, working with the college student population. And I take a critical methodological framework to the research that I do. So basically, I like to explore how do the systems at play, including systematic racism and different things like that, affect people of color in general. So how do these things, and in addition to having mental health and substance misuse and all the things, people of color also have that piece where they are situated in these structures and they can add additional mental health issues for them. Lastly, I have my own private practice in Durham, North Carolina. It's currently only providing telehealth therapy. And some of my other important identities are that I'm an oldest child, reality TV expert, A-Read. So even after we finish today's presentation, I'll probably catch up on some shows for my own self-care and mental health. And also, I think it's important to identify myself as an oldest child because the ways in which we have grown up and are situated in our birth order can definitely affect the ways in which we navigate the world. So let's get started. So the first thing I like to do with any presentation that I do is really talk about what are the goals that we are hoping to achieve and accomplish today. So at the end of this presentation, I want you all to have accomplished 3 goals. I want to have brought awareness to the mental health, specifically how it affects college students. I want you to be able to identify the dimensions of wellness and think about how the dimensions of wellness can help you cope. And lastly, I want to identify what are some mental health supports for college students. So again, July is Minority Mental Health Month. So this might be a lot of you all's first time hearing this, because I think if I wasn't a mental health therapist, I probably wouldn't know about this month either. But July, the Minority Mental Health Month started in 2008, and it's really just a way to bring awareness to the unique issues facing people of color. So we can think about some of the other mental health months or some of the other awareness months that we are aware of. For example, February being Black History Month, and then October being Breast Cancer Awareness Month. And the importance of awareness months are really to think about what are the ways in which people of color are impacted by mental health. So when you think about the ways in which mental health impact people of color, it's also a situation where this population is largely underrepresented in the research. So it's important for us to have programs like these, for you to all attend programs like these and really understand, how does mental health show up in different communities of color. So I first want to bring some statistics specific to students of color as it relates to mental health. So these statistics came from the Healthy Mind Survey. So a lot of you all, as you enter this upcoming school year, you're going to be assigned these different modules. So the modules are basically going to be assessing for things like mental health and providing you with information. So also within those different modules or assessment tools, they're really going to dive deeper into demographic information and get more information about how the incoming class is impacted by different forms of mental health. So I just want to highlight some of these statistics that are specific to students of color, college students of color, as it relates to their mental health. So the first three statistics talk about the percentage of African-American students, Arab American students, and Asian American students, and how they are impacted by mental health symptoms. So as you can see, 40% of African American students experience mental health symptoms. About 53% of Arab American students experience mental health symptoms, and Asian American students had about 23%. Now, this fourth statistics is kind of on the opposite end, where it's saying that although there was a large population of students within the different demographics or ethnic groups, only 21% received a proper diagnosis, compared with 48%. Now, we don't always want to do this comparative analysis where we're thinking about how do students of color show up compared to white students, because what we do want to center students of color, especially during Minority Mental Health Month, but we do want to show this number to show that sometimes when college counseling centers or counseling centers in general are not equipped to understand how different mental health symptoms such as depression and anxiety show up in different communities, they will not provide them with the proper treatment. So to look at it more statistically, and I know a lot of you all, again, you're going into your first year of college, so I'm sure you did as well as you could on the SAT, or might have done really well in your senior year in your different mathematics classes. So it's basically saying that four African American college students walk into a college counseling center, maybe only one of them, or not even one of them, will receive a proper diagnosis. So what that means is that if a therapist is trying to provide treatment to a college student and the student is a student of color, they may not know how to properly diagnose them, which means they won't be able to properly treat them. Now, this data is about 5 to 6 years old, because as I stated before, in thinking about the purpose of Minority Mental Health Month, is there's not a lot of data out there thinking about people of color and mental health. So even though this data is about 4 or 5 years old, the reality is some college counseling centers might not be equipped to handle the different treatment as it relates to students. But as we talk more throughout this presentation, you'll be able to think about coping skills and different self-care tips that you can use as a college student. And we can also talk about some other resources in addition to how you can still use the college counseling center to get the best treatment for yourself. I also want to show the last 3 stats are related to stigma. So this really talks about how the stigma related to, or the perception of mental health. And then you can see that these numbers are really not that high, because a lot of times counseling centers or people in general who provide mental health treatment will say things like, well, we had the program, we had the treatment, we can't help that they didn't come. But the reality is, are you molding and creating an atmosphere in which a student of color feels supported and want to engage in your services? So again, the stigma is not as high as we previously thought it was. Again, this data is 4 to 5 years old, but still pretty relevant when we think about the data that's out there, specifically about college students of color and their mental health. So again, before we dive a little bit more deeper into the resources and tips, we want to think about what are the barriers to help seeking as it relates to students of color. So the first one is not seeing anyone who looks like them. So I know when I went out to seek counseling in my age now, it was important to me to have a Black woman as my therapist. So sometimes when students of color go into these college counseling centers, all the demographics might not be represented. And that can be a barrier to treatment. But again, as we talk more through this presentation, we'll see that there are other ways in college counseling centers can still support you and help you find the resources and help you find that therapist who might share that same historical or ethnic identity. The second one is the stigma related to seeking mental health. So we talked on the previous slide, although those numbers are not as high as people would think they are in terms of what are the negative stigma I have in my mind as a person of color when it comes to that help seeking for mental health. It does tend to get in the way. If you think that only people who are super weak, or you think that mental health is bad, or it doesn't align with your spirituality, or you have all these negative thoughts about mental health, it will impact your ability to seek it. You won't want to go to the counseling center, or you won't want to engage in certain services because you have all of these negative thoughts that you've developed throughout the years as it relates to mental health. I put the model minority myth up here. This one is specific to Asian identified or Asian American students because this myth is more about the assumption that Asian or Asian American students are smarter, more intelligent. So even thinking about that and rolling into the stereotype threat, when you have these stereotypes that are commonly associated with your ethnic identity, it can impact the ways in which you show up in the world and how you feel people view you. So again, if your stereotype is to think that I'm always strong and I don't need help, you might be least likely to engage in mental health services because again, you feel weak, you feel it doesn't align for you or it doesn't align with your identity. And the last one's feelings feel invalid. So I hear this a lot from college students, especially college students of color, where you feel this sense of guilt for even being depressed and anxious, right? Like you might be a first generation college student and you are still you're not feeling completely happy about your college journey for whatever reason, whatever issues are affecting you. So you feel guilty. So you might not want to engage in those different type of services because you don't think what you're experiencing is valid. And the reality is these are going to be some barriers to help seeking, but you can kind of break those things within your family that might stop you or make you not want to engage in mental health services. And we can talk about some other ways in which you can find treatment and support. So I want to talk about some of the top issues affecting college students. So we talked about before those specific stats related to people of color, but I want you to think about, in addition to having that intersection of being a person of color, we also think about what are the main reasons or the main things that college students are showing up with when they come into these universities. So the reality is they might develop these things as they matriculate through their college career, or they might already come into college experiencing some of these things. So the reality is about 1 in 5 Americans are going to experience some form of mental health throughout their lifetime. So we think about depression being the top one. We think more about what does depression look like? So depression could be change of appetite, isolating yourself, and different things like that, where you're just really changing your routine and not necessarily on purpose, but it's because you have some sense of depressive symptoms are affecting you. Anxiety disorder. So anxiety are when we have those bodily reactions that bring up a lot of negative feelings. I see this a lot with students having panic attacks and different things like that. And the reality is transitioning to college or making any type of life transition is going to bring up anxiety symptoms for different people. The next one is suicide ideation. So this is when folks feel some level of suicidal ideation and they're having a lot of negative feelings and negative thoughts. Substance misuse is one I definitely see common in college students. And the thing about this one is it's not always included as a mental health symptoms. Even therapists who shy away from treating people or clients who have substance misuse. But the reality is substance misuse is normally that secondary issues. And most of the time there's some mental health symptom that's underlining your reasoning for engaging in substance use. So even if you're thinking about a person using substances because they have social anxiety. Reality is they have social anxiety. They don't feel comfortable in social situations. So they turn to substances so that they can cope with what's going on. So again, you will treat the social anxiety and then encourage the student to either stop or reduce their substance use. And then lastly, eating disorders. And I think this one is so very important because even though it's listed as one of the top issues affecting college students, the reality is it's a top issue for people of color who are college students as well. Even thinking about the diagnosis of bulimia, where there's binging and purging happening with foods, that is very common in both Black and Latinx women. And a lot of times when we think about the picture of eating disorders, we have this very thought what we think is just thin, white. We even think about maybe some of the ads we've seen over the years as it relates to eating disorders. It's normally having one type of person associated with that. Where we know that men can be diagnosed with eating disorders, athletes, all different type of people can have disordered eating behaviors. And again, all of these things require a mental health clinician in order to diagnose. So if you're looking up and thinking about some of these different issues and because a lot of us go through WebMD and all these places to provide diagnoses for ourselves, it's best to have a mental health clinician to make that official diagnosis. So again, they can develop the best treatment plan for you. So I want to talk about the uniqueness of the class of 2021. You all are facing a very unique form of the impact of mental health because you are navigating, having gone through your last year of high school during a pandemic and the racial injustice that have come from that. So we know that when I talk about 1 in 5 adults experiencing a mental health symptoms throughout their lifetime. And then we think about some of those issues that I just named, know that that data is pre-2020. So now that we've had the pandemic embarked upon us, we know that anxiety has increased, social anxiety has increased, depression has increased. And what we don't think about is just the fact that class of 2021 survived the pandemic. We think about all the losses that might have taken place while during the pandemic, right? So there's going to be some grief and loss because some people have lost family members during the pandemic. We also think about the environmental pieces, right? Having been in a situation where everybody went off to work and school, typically throughout the day, and now everybody was at home trying to do everything together, and how that impacted the different family dynamics during the pandemic. And then thinking about this other side, right? The racial injustice. So we think about the hashtags that were highlighted throughout the 2020 into 2021, thinking about George Floyd and Breonna Taylor, and so the Stop Asian Hate hashtags that came up, and thinking about these issues primarily affected people of color. So again, thinking about the students of color that matriculate and seek those support services from Say Yes Guilford, and thinking about all of the other things that I named that people of color face, and now having to kind of intersect between the pandemic and racial injustice. So it's almost like, let's give class of 2020 a hand clap, because you all were honestly like the pilot class, because, you know, I feel bad for a lot of people who came through 2020 because they didn't get all of the things or accolades they deserve. But 2021 was very experimental in that schools were trying to enact and create new ways of learning. So we were piloting this idea of a hybrid classroom model where we might learn from home and then also learn in person. And then you all navigated that. And again, even though you did come through it unscathed and experience lots of different things, the reality is you have a different level of resilience that previous classes might not have because they didn't have to navigate these two things at the same time. So thinking about what does transition into college bring up? So you all can feel, for those of you all who are on the call, if you wanted to drop some things in the chat about what do you feel like a college student, or if you're an incoming college student, what is it like to leave high school and now go into college? Like what different types of mental health issues or issues in general might that bring up for an incoming college student? And as you all start putting some things in the chat, I'll also start pulling some things that I've seen either from providing therapy to college students or just what I've seen in the research. So one thing that a lot of people are not aware of are mood disorders. So mood disorders are things like bipolar disorder, schizophrenia, and different diagnoses like these. So a lot of times those disorders might pop up in the age range from about 18 to 22. So while some people think so-and-so went off to college and had this experience, the reality is that a lot of those more severe and persistent mental health disorders might not show up until those later adolescent years. Some other things that people might bring up is, like we talked about before, those higher levels or increased levels of anxiety. Identity loss, exactly. Thank you. Identity loss is definitely a big one, because the reality is when you were a senior in college, you had this identity. Maybe you were, I don't know, captain of the football team or captain of the debate club and all of these things. And now you're going into college and you kind of have to start over with what your identity is. Peer pressure, imposter syndrome, absolutely. Imposter syndrome is a really big one, because I've definitely heard a lot more people talk about imposter syndrome this past year. But imposter syndrome in reality is where you think you don't belong in a space, even though you're definitely qualified to be there, right? Like you've gotten into college, but you're sitting in your college classroom and you are hearing these things going around you, and all of a sudden you start having these flooding negative thoughts where you feel like you don't belong, even though the reality is that you do, because you got into school. And maybe it's just, the reality is it's not that you don't belong there, it's just that you're having a difficult time navigating that from a mental health piece, and a counselor or even a group of supportive people around you can help you think more about that and navigate that. So thank you all for who provided that feedback. So, oops, I went back there. So the next one is first year fears. So someone in the chat talked about this one earlier, but one of the biggest years that first year students have is finding yourself. So again, you have all these values and things that you learn throughout your lifetime. But then when you come to college, you're really trying to think about, who is it that I want to become? What is my identity going to be in college? And that can be overwhelming. That can bring up a lot of anxiety, a lot of anxious symptoms. It can make you feel overwhelmed because you're really trying to figure out, who is it that I plan to be as I move through my college career. The second one is loss of your social support system. So not necessarily that these people are going to disappear or no longer be here, but physically, those people might not be as readily accessible. So if you're a person who typically turns to your parents or another guardian or your siblings, and now the reality is that those siblings, cousins, those folks will not be there in close proximity like they were before. So you're trying to figure out, how can I still maintain that close relationship with them, but realize that physically they're not there. So you're almost kind of having to build a new social support system. The third one is relationship concerns, and it's not just romantic relationships. We know that friendships and friends can be just as toxic and definitely impact our mental health. And as a college student, even though your main goal is going to be to obtain a college degree, the reality is relationships are going to take place. So any parents that are listening to this call, or people who are supporting incoming college students or college students, know that it's normal to have issues with relationships. One of your very first issue with the relationship might happen when you step through the front door of your residence hall and you and your roommates, for whatever reason, are not clicking. And then the last one is navigating new environments. So some of you all might be fortunate enough, because I think primarily Say Yes Guilford serves students who live or residents of Guilford County. Some of you all might be fortunate enough to attend like UNCG, A&T, Guilford colleges in your environment, in your same areas or neighborhoods, but it's still going to be a new environment, because even if you visited UNCG or went to A&T your whole life for various camps and different games and stuff, you were never there as a college student. So it's still going to be a new environment for you. And all of these things are normal. All of these things are things that college students fear and have issues in dealing with. So it's very common that these issues might come up. So next, I want to tap into the 8 dimensions of wellness. Now, the dimensions of wellness are some of my favorite things to talk to or educate my students, my clients, and different people about, because it kind of helps to compartmentalize or to kind of help better identify how we find our different levels of self-care and coping skills. So most of the different coping skills that you all have on this call probably fall under one of these 8 categories. So even tonight, as you listen to this presentation about mental health, you're tapping into your emotional dimension of wellness, because you're learning new information that you might not have known about mental health as it relates to college students. Intellectual wellness, just by deciding to go to college, you are definitely tapping into that level of wellness. And then of course, financial wellness. So we know that college careers can open up new doors for us, which might expose us to different levels of financial opportunities. So when even looking at the different dimensions of wellness that I named, you think about what are some questions that I might want to ask myself, right? So which areas are most important to me? So you might have looked at that and maybe looked at the things under spiritual wellness, and maybe you think spiritual wellness is not something that I find that important, so I don't really want to spend time dedicated to that. Or you might see that somebody else might see that same dimension of wellness and say to themselves, I do really want to work on these things. And thinking about which areas do I need to work on, even if I don't want to. So again, some folks are going to go into college and they're going to be in totally new environments and they're not going to know how to navigate that. So you might find yourself, even though your primary goal is commitment to intellectual wellness, you might find some things dipping as it relates to that commitment, because you're not really sure about how much time I need to spend on this. And then thinking about, are there other types of wellness? So I named 8 different dimensions, but I don't control the dimensions of wellness. If you have something going on that you're already doing to cope and you're saying to yourself, this might fall under a different category, feel free to add it. You have the autonomy and control to treat your dimensions of wellness in the ways that you want to, so that it can best help you matriculate through college and really matriculate through life. And then the next one is asking, in my own pie chart, how much attention do I want to invest? So again, a lot of people are going to be listening to the recording and not listening in real time, because their commitment to wellness this summer might be more aligned with social wellness. So they find it important to let me spend time with my friends and family, because I know that once I enter into college, my day-to-day balance is going to look a lot different. And then the last one is how much attention. So even if you want to do it as percentages, so I'm going to spend 30% of my day in class, another 10% dedicated to studying, but maybe I'm going to spend 15% to making sure I check in with the different relationships I have established in college. So again, I always tell clients and students to really think about those dimensions and being able to tap into the different ones so that you can have optimal mental health and wellness. So the reason I'm kind of highlighting 5 versus the other 8 is because a lot of times the different coping skills that people come in with fall under these 5 categories. So when we think about physical wellness, it's not just about, am I getting 30 minutes of exercise 3 to 4 times a week, right? That's important. And physical wellness can look like, am I paying attention to the body sensation or the things that's happening to my body that come up when I'm in certain situations? So even when we think about the anxiety that comes along with attending college or attending a certain class or being around a certain person. That's paying attention to our physical wellness, because there's something about the situation that we're in that's making us feel anxious. And anxiety is not always going to look like ruminating negative thoughts, even though that's very common. It also can mean that my body is not responding well to what's happening around me. Emotional wellness includes psychological and spiritual. Social wellness, again, as we've talked about a few slides now, identifying who we want to be. So culturally, if I decided to attend a predominantly white institution, how do I make sure I'm still aligning with the cultural values that I brought into this institution with me as a person of color? And how am I able still to be true to myself? That's really tapping into social wellness and belonging. Professional could look like not just classes. What am I doing outside of class? Am I establishing those relationships with my professors for networking opportunities? And then environmental. And environmental is so very important, because some folks are not studying my room people. Some people are, let me study in the library type of folks. Some people are, let me study downstairs in the break room type of people, because maybe your room does not provide the environment that you need to thrive. We know that a lot of issues that come up with roommates might be different sleep schedules. One roommate wants to watch television. One roommate likes to have their friend in the room. But if you want to establish rules and setting boundaries, again, with physical wellness with your roommate, and then environmental wellness, making sure that the environment you have for studying is conducive to you learning, all of those things are wellness, and all of these things contribute to optimal mental health and wellness. So I really like to explore the dimensions of wellness, because I want students to realize you have all of the tools that you need. A lot of them are already in you, and you just need someone to help you process and realize that a lot of the things you already do are really tapping into your mental health and wellness. So on this next slide, I want to point out the self-care wheel. So the self-care wheel is taking those dimensions of learning, dimensions of wellness that we've already gone over, and it's helping us identify what are some other things that fall within those categories. So even thinking about the aspect of psychological wellness, right? The reality is some people are not going to counseling, right? We can have Minority Mental Health Month. We can have presentations about mental health, but some folks just don't feel like they align with therapy, and that's okay. There are other ways to tap into your psychological well-being and making sure that you are mentally well. It could be thinking about your positive qualities. I definitely like to tell students and clients that I work with to do like an inventory, so you can see what are the good things about myself and how can I use my strengths to do well as a college student. It could be therapy, self-reflection therapy, where you're doing your own level, asking yourself your own questions, and really doing some self-awareness work within yourself. Journaling is an activity that a lot of folks, even before they came to me as a client, might have done previously, and they found it really helpful to kind of reflect back on some of the even more negative and positive experiences they have, just to see how far they've come. Physical wellness is, again, am I taking time off? So the reality is some folks use those fall break opportunities to go home and visit their family. Some people are studying all through fall break, so they're not really giving themselves that time to relax. And again, as we think about that balance and how we want to balance our schedule and our different dimensions of wellness, we might think about, okay, well, during finals time, my professional wellness or my psychological wellness is going to go up way higher, because I'm going to spend 75% of the time studying, might spend 5 to 10% of the time doing self-reflection. And that social wellness piece is not going to have as much attention paid to it. But again, like now during the summertime, social wellness is given more percentage, has a higher count. And it's just going to go up and down throughout life, because the reality is, as we matriculate through life, we're going to have different needs at different times. But knowing some of the different types of self-care that is out there, having somewhat of a coping toolkit, and seeking therapy if we need it or we feel like we choose to, all of those things together can really help you move through life in a different way. And I really want to highlight this one under personal wellness as well, because that is a really good activity that you can start doing even before you get to college. Again, thinking about who you want to be or what type of identity you want to have, that can look like establishing some short and long-term goals, right? Even if you have gone on the website of these different institutions and you've seen some clubs or organizations that you joined, put that down as one of your goals. By 2 months in, I want to have met 2 new people from 2 different cities in North Carolina, or somebody from out of state. Like, it's okay for you to make goals like that. Like, sometimes goals like that can seem kind of corny or not realistic, but the same way we have goals of achieving six figures by 30 and all these other things, you can make little small goals like, I'm gonna make a new friend, I'm gonna call my mother this week. These different types of goals can be helpful for your mental health and wellness as well. And they're measurable and they're easier to obtain because you can do those day by day or week by week. So now, even thinking about how do I access these resources? So I know I've talked about therapy all through this presentation. So now we're really getting to, now if I do want to go to therapy, how do I do that? How do I make that happen? So I didn't want to put any particular counseling center's website up here because I'm not sure where everybody is going to school, but I do want to talk a little bit more about the process. So I used to work at UNCG, so I want to talk about their process for accessing resources, because I thought they really had a really good process of being able to bring students in, assess them properly, and assign them with the appropriate therapist. So let's say you're a college student, you're having a difficult time, you're feeling a little overwhelmed because maybe you miss home, or you're feeling anxiety, the imposter syndrome is really starting to get to you. So you came to this presentation and you remember, oh, what can I do to help that? So what you want to do is either call to the counseling center. The number is going to be on your institution's website. You can really just, whatever school you're going to, let's say you're going to North Carolina Central, just type in NCCU Counseling Center and the number to the webpage will pop up. You can probably call the counseling center to make an appointment, or you can walk in and do an appointment. So typically what happens is when you walk in, you'll fill out some paperwork and you will do a short assessment. So the assessment is going to tap into different categories with under mental health. So it's going to bring up anxiety symptoms, depression symptoms, might even address substance misuse, eating disorders, those things that I named before that you might be experiencing. And then this assessment will be what the therapist that you meet with, they will look at that and then figure out how to best help and serve you. So when they get that assessment back, depending upon how severe those symptoms are, they might suggest that you do individual therapy. If they might suggest that it be a crisis appointment. So this will be for a student who's experiencing some suicidal ideation. So the therapist might do a crisis appointment with you and then say, well, let's follow up again in 2 weeks. And then let's engage in some individual therapy. And the thing about individual therapy and crisis appointments is most of the time those therapy will be ongoing. But the reality is counseling centers typically operate in a short-term treatment model. So what happens is after about 8 to 10 sessions and students are still feeling pretty severe, they might connect you with the case manager on campus, and that case manager can help connect you with a therapist offsite. So sometimes, again, it might be important to, because of that stigma piece, you might want to see a therapist who's not working at your direct institution, and the case manager can help you access a therapist for a reasonable cost. Other forms of therapy include group therapy and workshops. So when we think about what group therapy looks like, you're probably thinking about an Alcoholic Anonymous meeting where someone is sitting in a circle, my name is so-and-so, and I struggle with alcohol, or I'm addicted to alcohol, right? And the reality is those type of groups are helpful for people who have issues with alcohol use. But if that's not what you're coming to counseling for, you don't have to worry about that format. But the reality is if a lot of students thrive in environments where they're doing some form of group learning, and there's a therapist who facilitates the overall conversation or themes, but you might be able to learn about different coping skills and techniques for other people in that room. So even thinking about breaking that stigma, it might be good to try group therapy or workshops, because maybe what you're dealing with is best served in a group environment. And I know UNCG does a great job of coming up with workshops. So again, as you fill out some of those assessment data as incoming college students, it will help your institutions, particularly your counseling centers, think more about what are some workshops we need to create to help serve our student body. And again, case management, they can help you connect with a psychiatrist because some people might need medication management in addition to therapy. They can help you connect with therapists off campus. I know case management throughout this past school year looked like helping students connect with therapists in their community, because a lot of people might have been attending college virtually and not actually in person. So it's really, most college counseling centers are really, if they can't help you with individual therapy, the least they could do is provide you with some type of case management. But workshops are ongoing, they're unlimited. You can engage in all different types, especially as students of color. Those identity-based workshops can be very helpful because, again, it's helping you to think about some of this trauma that I'm experiencing with discrimination, racism is not just something that's individual to me, but I can talk about it in a group environment, and I can feel supported by other people who share those same ethnic identities. So now thinking about some additional resources, right? So here's the National Suicide Hotline. You can engage in that site or that hotline, it's either through Spanish or English. The Open Path Collective. Now this is a resource I literally just learned about last year, but Open Path is a site where you can find therapists who are willing and committed to reduce costs for therapy sessions. So while therapy sessions could range anywhere from $100 to $200, people in Open Path Collective are committed to maybe charging $30, $40 for a session. The sliding scale is another, if you see this buzzword on these different counseling center websites, this means that the therapist has reduced costs for certain types of clients. So again, it could be based on financial need, or it could be based on clients who might be college students. Psychology Today, although having a problematic past with Psychology Today, the reality is it's one of the most widely accessible resources because it has all different types of counselors up there. And the reason I like this website is because you're allowed to put in your insurance information, what you're dealing with, and can easily find therapists in your area. They might be doing telehealth like me, or if you're comfortable seeing a counselor in person, they will have that on their site as well. Therapy for Black girls, and even though it says for Black girls, is really a site to identify Black therapists. So there are men and women up here who provide therapy, and it's a really good resource for people to access. Talkspace, Headspace, and Sandelo are all apps. So we know that people, again, incoming college students, you love your phones, and that is great. Our phones are great resources. So you can also use your phone to engage in some apps that can benefit your mental health. So you see the girl over here doing her little yoga pose. It's because she has engaged in one of these apps, probably Headspace, to meditate because she was feel anxious and overwhelmed about her class or test that she has to take or something going on with her roommate. But she said, let me meditate for a little bit and really tap into a easily accessible mental health resources to help me deal with what I have going on. So there are lots of resources out there, but these are some of the ones I really just wanted to highlight because they have been very useful for some of the clients that I have worked with in the past. So I wanted to put this quote up here before we move into the Q&A section. And it says that your mental health is a priority, your happiness is essential, and your self-care is a necessity. Now, I'm not sure who the author was that came up with this quote, but this quote is so true, right? And we think about the ways in which our mental health is impacted. If our mental health is not where it needs to be, it makes it very difficult to concentrate in class. And we having all these negative thoughts, and we feeling overwhelmed and have imposter syndrome, it's going to be hard for us to understand what our professor is talking about. And people who are not engaging in some of these self-care tips and really focusing on coping do not have that level of happiness. They might claim to, but I doubt if people don't have some form of self-care and coping in place, they're probably not reached a level of happiness, but it's essential and it's necessary. So again, my man over here in the little cartoon, he is engaging in his self-care, which might include video games. So yes, I have given you all a great wealth of information as it relates to mental health for college students and minority mental health. And next is the Q&A. So I can just read. If you all don't mind, if you have questions, just feel free to drop them in the chat and I'll just start responding to them. So we have about 15 minutes for the Q&A portion, and I will respond to those in the order that I see them. So the first question I see in the chat is, how can I help as a parent? So as a parent, it really can just be talking to your students about mental health, right? A lot of subjects that parents talk to their students about, it might feel taboo, right? Like parents probably check in a lot of things like your class schedule, different things like that, but really asking your student, how are you doing? How are you feeling about being a college student and what's coming up for you? And then sometimes too, I find from parents or anybody in a support role, it's better to ask the person, what do they need versus just giving your unsolicited advice. So it might look like your college student is calling you, they're in crisis, my professor, blah, blah, blah. They might need an encouraging word, like a personal cheerleader. They might just need you to listen, but it might be helpful to ask, what do you need from me in this moment? Or would you like some advice before just giving it? Because that can add additional stress to your college student. The next question I see, what should I do as a parent if I'm concerned about my child? So again, a lot of these different disorders and different things like that are not stuff that's accessible, but you can go online and look at some of the symptoms that your students might be experiencing. So if you have a college student who is experiencing some of these symptoms, what you can do is they have like certain colleges have where you can do a wellness check for your student. So that might look like calling to the counseling center, saying you're concerned about your student, and they can send someone to do a wellness check for that student. So that's typically a good go-to method. If you have a student who you haven't heard from all day or a couple of days, it might be good to have a wellness check done on them so you can figure out what's going on with the student. The next question I see is, what do I do if my family doesn't believe in therapy? They say that's telling the family business. Oh yes, that is one I hear all of the time in communities of color, right? You know, folks will say, oh, you can't, I don't need therapy, I've got Jesus and all those things, right? But just like Jesus or God or religious created all these professions, mental health therapy, social work, psychology, all of these things are things that you can tap into as well. So prayer is a great coping skills. I've noticed that my clients of color have very high levels of spirituality, and that is very helpful for them to cope. In addition, it also is helpful for them to get therapy as well. So doing both of those things at the same time. I've always allowed my clients, not just my clients of color, any clients who come in talking about mental health symptoms, I always allow them to talk about how spirituality plays into their mental health and wellness. And it's good that your therapist, who is a good therapist, who culturally competent, would allow you to do that. What are other ways to cope? So I named a lot of those in that self-care wheel. So if you want to take a look back at the recording, I'm sure when they issue it out, it's one you can look at over and over again. But the reason I like that wheel is because it has so much information up there. So it could look like journaling. It could look like, some people do find some level of coping and self-care and doing yoga and meditation and different things like that. So there are a lot of things. Social support might be your coping skill. So there are a lot of different things you can do if you don't choose to go to counseling. I just like to tell students also, I don't know, you're already paying for it, so you might as well go. That's another thing I like to tell my college students, like you see that student health fee, it's in your tuition. So it might be just for you to even try it out if it looks like just going to a workshop. But there are a lot of ways of cope that don't include counseling. And the great thing is some of those apps can be helpful, as well as even looking online to see other coping skills that could be helpful. Thank you for that question. Let's see, I mentioned birth order having a big effect on students' mental health. Can I explain? what my eldest child has also been a first generation student experience. Yes. So the reason why I mentioned birth order having an effect on mental health, because a lot of time what tends to happen on family dynamics is the oldest child might have a different level of responsibility that other children might not face, right? So when you're thinking about the intersections of being an oldest child and a first generation college student, you're thinking about having all of these people dependent upon you for success. So as a first generation, your family is already probably like, yes, we're sending so-and-so off to college. We know that they're going to do well. We believe in them, but we might not really know how to support them because we have never been to college ourselves. And then thinking about as an older child, in addition to feeling that pressure of being the first person in your family to go to college, now you also might feel even additional pressure because maybe you were the one at home being the disciplinarian, taking care of your younger siblings. I saw this show up all the time when I was working at the counseling center, when I worked at North Carolina Central, and even some at UNCG, where I had students who would come see me and they had to like call and help discipline their younger sibling over the phone. So think about all the mental health symptoms that I named before that college students face in terms of anxiety, having to play this role in your family, and then still having everybody in your community and family dependent upon you. So that brings up a lot of different mental health issues. And a therapist is a great person to help process that with, because even though there are lots of coping skills out there, being able to have a conversation with someone about all the different mental health symptoms and feelings that are coming up for you is something that like a coping skill might not be able to help with. So I see someone asked, what do I do if one of my friends is feeling depressed once I get to school? So the same thing I shared before about the wellness check. I know at another institution I work for, they have this student of concerns report that you can fill out, and they will have a case manager who will contact the student to get more information. Because sometimes if one of your friends feeling depressed, what it tends to look like is not just my friend saying I'm depressed. It's more so like that friend begins isolating. So you all were hanging out, and now you notice they're not coming to group activities anymore. They're not want to do certain things anymore. So you want to check in with them to see what's going on. And you can also call the counseling center to say that you're concerned about someone, and someone can send a person out to do a wellness check just to see what's going on with that student. And I've also seen a lot of times where a friend would walk another friend to the counseling center to help them engage in therapy, because sometimes people just need that added physical support system to help them to be able to go to the counseling center, because maybe they're scared to go over there by themselves. So someone said, earlier comment was, do I have to attend counseling at school? What if I want to go out counseling off campus? Yes, this is, so when I talked about those sites like Psychology Today and Therapy for Black Girls, those can help you find counselors off campus. Open Path can help you find counselors off campus, but also the counselors in the counseling centers. And when I say counselors, I'm talking about licensed social workers, licensed psychologists, and people like myself, licensed mental health counselors. Most of the counseling centers have all three, but each of those folks should be able to connect students with, they should have a list of counselors who can treat college students who off campus, because some people don't want to go to counseling in their school. They don't see a therapist that looks like them on staff, or maybe they had a bad experience in the counseling center. So now they still want to engage in therapy, but they just don't want to deal with the folks on campus. So yeah, that someone should have the resources available for you at your center. I know UNCG, again, when I worked there, they had their own case manager whose job was to find counselors. Now, at smaller institutions like Guilford colleges, places like that, they're not going to have this, they're probably not going to have like a dedicated case manager, but all counselors do some level of case management. So they should be able to provide you with a list of counselors that you can go to off campus who can give you a reduced rate or might cover counseling, might take. So I think students who go to college, typically they don't use their parents' insurance. They do like Student Blue or whatever, which is a different type of Blue Cross and Blue Shield insurance. So they can help you connect with therapists who use that particular insurance. So I see another question that says, can I volunteer with the counseling center if I'm interested in becoming a therapist? Yes, so even the counseling center is a confidential environment. So what happens is the counselor might do a thing where they like allow you to do like an informational interview. And I think this is a good technique for students in general who are interested in different type of careers. If you're interested in becoming a professor, if you're interested in becoming a therapist, you can reach out to those folks to see if they will allow you to do an informational interview. Now, a counselor might not allow you to do that during the day because they might not want you to know other students who are engaging in therapy. But I've definitely done some informational interviews for students who wanted to learn more about what it looks like to become a college counselor. In addition, some counseling centers have like peer education programs. So they have a group of students who will go out and do presentations related to mental health. And that's a great way to volunteer. So let's see, another question. Are parents allowed to have access to student counseling records? No, they are not. So they do have this thing called FERPA. If a student allows their parents to do the FERPA, what happens is they do have access to a student's grades, but when it comes to counseling records, those are confidential. If your child is over the age of 18, you will not be able to access their counseling records. So like even early in the chat when someone talked about being afraid or unsure about coming to therapy because their family might not want them to. The reality is your family will never know if you engaged in counseling unless you told them. In addition, there has been situations where I've allowed students' parents to come with them into the session. That parent felt like a support for them in the moment. But the reality is the counseling is for the student. It's not for the family. They can refer you to family therapists who can see the parents and the students together. And if your child is not 18, they more than likely they are not allowed to see counselors in a counseling center. But again, the case managers can provide resources for students too, because a lot of students start college at 17. So the counseling center, I don't think counseling centers will see you if you're not yet 18, but they can also still provide you with resources for you if you're only 17 years old. All right, it looks like we have a few more minutes. Thank you all for those great questions. You all are so very engaged and you asked a lot of great questions. Do we have any more? And like I said, a great thing about having a recording is you can go back and listen to it. So I know I'm a speed talker, that's one of the things I do when I tend to get nervous in terms of transparency. I find myself like, I done went through things kind of fast, but great thing is a recording so you can listen to it over again. All right, well, if we don't have any more questions, I'm going to go to the slide where you all can contact me. So you can email me so the name of my business is The Melanated Space. I don't even think I said that in my biography, but the name of my business is The Melanated Space. Again, committed to providing mental health and wellness for communities of color. This is my email address, themelanatedSpace@gmail.com. Feel free to follow me on social media. I post different posts around racial trauma, racial injustice, mental health issues that take place in communities of color. And my website is probably the best way to find me. And again, I only see people 18 and up. So if you have questions about providing or even engaging in therapy, again, with someone who does not work at your school's counseling center, I also, if I assess someone and they're not appropriate for my practice, I also provide a list of referrals for clients as well. So I am going to stop sharing now, but hopefully you all get my information down.
All right. Well, thank you so much, Whitley, for that just amazing presentation. I'll be a first-time graduate student. I'm also first gen. I'm the eldest in my family, so I know I learned a lot from your presentation that I can use in my personal life. And to all of our participants, we hope that you learned something. We hope you can pass something along. As Whitley said, this is being recorded. So if you would like to revisit this conversation, you can go to our YouTube page, just search Say Yes Guilford, and you should be able to view it within the next few days or so. So if no other questions are going to be asked, we wish you all a good night and thank you so much for joining us.
Good night, everyone.